This Christmas, New Year, Sankranti, ZIVA Fertility offers you a 30% discount on IVF packages. To know more about this, please feel free to contact us on the numbers that you see on the screen or visit your nearest ZIVA Fertility Center. Thank you. Hi, I'm Dr. Suvarchala, Scientific Director with ZIVA Fertility Centers. In IVF, we have a very rigid success rate depending on the woman's age. Why is it so? Why don't all embryos implant across age? Let's talk about that. To understand this, get to know the fact that as a woman's age advances, the egg chromosomal abnormalities also increase. So it's very important to keep this in mind before we talk about why embryos do not implant. So that's one factor. As age advances, the implantation potential or the capacity of the embryo which is formed also reduces to implant and make the woman pregnant. So that's very important in IVF to consider the success rate. There are two parts to IVF. One is making embryos and the second is putting the embryo back inside. Making of the embryos is something which is happening outside the body, and there are many means and grading systems and methods to understand the quality of egg and sperm. When we look at an egg, we can define the morphology. Is it of good quality? If the woman's age is more, is it correlating? Is the quality of egg bad because of her hormonal values or because of endometriosis or PCOS? All these can be visualized once the eggs are out of her body. The second is sperms. Sperms can also be visualized when doing IVF. If the morphology is bad, the motility or the count is low, all can be visualized, and we can understand why the patient may not be getting pregnant naturally, or are the sperms also a contributing factor. Not only the egg and sperm, the embryo that is formed by the union of this egg and sperm can also be analyzed. It is called as morphological grading. Depending upon the size, the shape, the way it is dividing according to the day and stage, embryos are graded. They are given grades from A to D, A being top and D being very low, depending on the factors that I have talked about. And it is assumed that top grade embryos have a higher potential to implant. So all these are also kept in mind when we are deciding or assuming the implantation potential or the pregnancy rates of that woman. So it's very, very critical. And then once back inside, once the embryo is transferred into the endometrium, what's important is the endometrial thickness, the progesterone levels, the blood flow in the endometrium, which will support the embryo implantation. All these factors also play a very important role in success rate of an IVF cycle. If you want to understand more, if you want to know how embryos are made, how IVF can give you a better success rate than where you are actually, please feel free to contact us. Thank you. A lot of effort has gone into making this video. Please like and subscribe us. Thank you.